Have you ever felt that profound frustration when your blood pressure numbers remain stubbornly high despite doing everything right? You eat healthy, you walk every day, and you take your prescription medications exactly as scheduled. Yet why won't those formidable numbers budge? It feels like a health betrayal. The scariest truth is not that high blood pressure causes stroke, it's that your best efforts are failing. The shocking truth, uncovered by cardiologists at Harvard and the NIH, is that millions of people over 60 are unknowingly taking common pills that are silently and powerfully raising their blood pressure. These medications soothe your headache or clear your sinuses, but they also tighten your blood vessels, strain your heart, and force your body to cling to salt and water. We are going to expose the 5 silent saboteurs. Stay with me until the very end, because the pill coming up at number 1 is so common it's found in nearly every home, and this knowledge could protect your heart. Pill number 5, common pain relievers, the arthritis trap. Pill number 5 is what you know as ibuprofen or naproxen, common pain relievers. Millions of people rely on these over-the-counter NSAIDs for arthritis or chronic pain. Their simplicity is their greatest danger. These medications directly interfere with how your kidneys manage fluid and salt. NSAIDs block hormones called prostaglandins, which signal the kidneys to flush out excess salt and water. When these hormones are blocked, the body retains fluid and sodium. This increased volume puts pressure on your blood vessels. The American Heart Association, AHA, found that daily use of these pills can raise blood pressure by an average of 5 to 15 points, an increase that creates dangerous strain on the heart, especially for those already battling hypertension. If you rely on these daily, talk to your doctor about dosage adjustments or heart-safer alternatives like acetaminophen. Pill number 4. Cold and sinus pills, the cold and sinus spike. Pill number 4 is the common box you grab for immediate relief when a cold or allergy hits, cold and sinus pills containing powerful decongestants. These medications promise instant relief from stuffiness, but cardiologists issue stern warnings because they can cause a sharp and dangerous spike in your blood pressure. The active ingredients, like pseudoephedrine or phenylephrine, mimic the effects of the stress hormone adrenaline. They forcefully shrink the blood vessels in your nose to clear congestion, but critically, they also powerfully constrict arteries throughout your entire body. This widespread squeeze forces your heart to pump blood with extreme effort through tightened pathways. A Harvard Health report suggests that even a single dose can raise blood pressure by 10 points or more in susceptible adults over 60, placing unexpected and sudden strain on your heart. Always check the label for the letter D or the word decongestant and avoid them entirely if you have hypertension. Use safer methods like saline nasal spray, steam inhalation, or humidifiers instead to safeguard your cardiovascular health. Pill number 3, mood and sleep medications, the mood and sleep disruptor. Pill number 3 includes antidepressants and sleep aids, medications that are absolutely crucial for mental health, but which carry an unexpected and subtle cardiac impact. Some older antidepressants, like tricyclics, directly interfere with the nervous system's sophisticated control over blood vessel dilation. Consequently, they keep your blood vessels slightly more constricted than normal, subtly increasing resistance and forcing your heart to work harder over time. Furthermore, research from the Cleveland Clinic suggests that prescription sleep aids can disrupt healthy nocturnal breathing patterns, leading to subtle oxygen imbalance while you rest. The body perceives this imbalance as a threat, releasing adrenaline, which subsequently elevates blood pressure readings the following morning. Most people do not feel this silent, day-after-day increase. Crucial warning: never stop these medications suddenly. Instead, discuss dosage adjustments or heart-safe alternatives like cognitive behavioral therapy, CBT for insomnia, or magnesium supplementation with your doctor to support both mind and heart. Pill number 2, paradoxical heart medications, the paradoxical prescription. Pill number 2 is arguably the most paradoxical medication of all, blood pressure and heart pills themselves. While essential for cardiac health, certain treatments can backfire in older adults. Beta blockers, such as metoprolol, are prescribed specifically to slow the heart and ease its workload. However, in individuals over 65, if the dosage is too high or if their body's physiology has changed, the heart rate can drop excessively, a condition known as bradycardia. The body perceives this sudden, excessive drop as a dangerous lack of blood flow to vital organs. As a survival mechanism, the body instantly releases adrenaline to compensate. This potent stress hormone constricts blood vessels, paradoxically causing the blood pressure to spike rapidly, a dangerous phenomenon known as the rebound effect. Furthermore, diuretics, water pills, can aggressively flush out crucial minerals like potassium and magnesium, which are absolutely essential for keeping blood vessels relaxed. Their deficiency causes arteries to stiffen, making stubborn hypertension impossible to control. The medication that was a lifesaver at 50 may cause severe imbalance at 70. An annual dedicated medication review with your cardiologist is mandatory to ensure your treatment aligns with your aging body's current needs. Pill number 1, the fast-acting fluid trap, steroids. Pill number 1 is the most powerful and common culprit, steroid pills, including prednisone and cortisone. They are widely prescribed for severe allergies, asthma, or acute arthritis flares because they provide rapid, often miraculous relief by crushing inflammation. However, these powerful steroid hormones directly and aggressively signal your kidneys to retain every possible bit of salt and water. This dramatic and rapid increase in fluid volume inside your vessels creates immense, rising pressure throughout your circulatory system. Research published in the British Medical Journal conclusively showed that steroid use, even at moderate doses, causes a significant, measurable blood pressure increase, placing tremendous, silent strain on the heart and vessels. Steroids are primarily intended for short, acute bursts of treatment. Long-term or repeated use must be approached with the utmost caution. If you are currently taking steroids, strict salt restriction and vigilant home blood pressure monitoring are mandatory. Always discuss non-steroidal or heart-safer alternative treatments for your underlying condition with your doctor. We have successfully unmasked the 5 silent saboteurs: pain relievers, cold pills, mood/sleep aids, paradoxical heart medications, and steroids. The reality is that high blood pressure isn't always caused by salt, stress, or genetics. Sometimes it's the hidden, insidious side effect of a pill you've trusted for years, one that quietly undermines your efforts. Your power lies in knowledge. Your most important action must be: do not stop any prescription medication suddenly without immediately consulting your doctor. Instead, book a dedicated, focused medication review appointment. Bring a complete written list of all your medicines, including all over-the-counter pills and supplements, and ask this one profound, heart-saving question: could any of my current medicines be secretly raising my blood pressure, and can we safely consider a heart-neutral alternative? This single focused question can resolve years of frustration, finally stabilize your numbers, and actively protect your cardiovascular future. If you found this information eye-opening and empowering, please hit the like button and don't forget to subscribe for more science-backed health insights. Your heart deserves that detailed care, every single beat of it.